Hi there. Welcome once again to the program, Your Doctor and COVID. I'm your host, Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We continue our conversations around the COVID-19 pandemic. We're now in a new year in 2021, and the COVID-19 pandemic is still here with us. We are still discovering positive cases, and unfortunately, we are still having patients dying from COVID-19 infection. Remember, if you have any questions or comments, feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Again, I want to emphasize the correct way of wearing your mask. If you can see me, you will see that my mask is covering my nose and my mouth. And when it's time to take it off, I will use the straps around my ears to take it off. For the rest of our conversations, I will keep it off because I'm the only one here while recording this program for you. So no one is putting me at risk, and I'm not putting anyone else at risk. We look at COVID-19 in Guyana as we're entering the new year in 2021. And we can see our numbers first week of January 2021. The total number of cases in Guyana has been recorded as 6,351 positive cases. Unfortunately, we would have had 164 deaths. That's 164 deaths. This represents a case fatality rate of about 2.5%, quite comparable to anywhere else in the world. We're no better, we're no worse, we're right in the middle. And the number of recovered cases is 5,894, which gives us a recovery rate of greater than 92%. And again, that is in keeping what international standards has been. If we look at our performance in terms of daily new cases that are recorded, we see that the graph peaked sometime in September, October, and it has been on an encouraging downward trajectory since then. We don't know if that's a false signal or if it will be maintained and stay the same, but we are nevertheless encouraged. My guess is after the holiday season, and the prediction of many experts in this field is that we will see a rise towards the end of January and February 2021 on the number of positive cases on a daily basis. The real trouble is the death rate and the ICU admission. And hopefully, even though we have positive cases coming along, we will continue to see a decline in death rates and sick hospitalized patients. The number of active cases in Guyana is perhaps also mirroring the number of positive cases per day. And we see again that they have peaked, or the first peak was in the September-October period, and it has been so far on the decline, at least when you look at the graphical representation of the numbers. We are all hopeful, and we are all basically wanting that this to be true, that we are on a downward trajectory and our cases are getting better, and we're thankful if that is true. In 2021, our biggest discussion and the biggest advancement will be around the COVID-19 vaccination program. And it is important for us all to understand the basics of vaccines, and in particular, what is involved in the COVID-19 vaccine process. There are lots of misinformation, lots of doubts, lots of cloudy area and information out there that can confuse people and can cause you to hesitate to take vaccines and to protect yourself. Well, in order for you to combat this kind of misinformation, it is important to replace ignorance with knowledge. And so that is part of the discussion that we are going to have today and tomorrow. How do we approach vaccines? There's a very complex science that surrounds it, and for these things to reach to a state of human usage, they would have had to undergo a very strict and rigorous process of scientific evaluation. So it's not an accidental process or an experimental process that we inject these vaccines into humans. These are actually well-studied, well-evaluated scientifically by experts in the field before they actually make it to the population for vaccination programs. So it's important for us to understand what are vaccines and how they actually work. And we've all, once you live in Guyana, you would have had some kind of vaccine. And that's one of the things that we're proud of in Guyana. We have a very robust, very successful vaccination program. Our public health officials, our nurses, medics, doctors in the regions, etc., these are very highly skilled, specialized people that continue to provide an invaluable service to vaccinate the population. We've all had polio vaccine, we've had DPT, MMR, and these are from oral drops to injections, etc. And the injections or the vaccines for COVID-19 so far are going to be injections. And most of them, in fact all of them so far, have been given on the shoulder, on either the left side or the right side. And that's the standard approach to giving these vaccines by injections. So vaccines, how do they actually work? We take a dead or a weakened germ and we introduce that to the human body. When that weakened or dead germ is introduced, the human body then starts to produce antibodies or soldiers to fight against that particular weakened germ. It produces it and it fights off in the short term, but it also produces memory type of immunity. So these are cells and proteins in the body that have a memory, so that sometime in the future, if you should encounter these same germs, these same viruses, your body's defense mechanism remembers them and is therefore able to mount a specific response to combat these kinds of infection. So vaccines generally enhance your natural defenses without causing the illness, so that when you are exposed to the real thing in high doses, in the infected types of doses, your body already has a prepared defense mechanism that could fight against it. And that is very important because that is how we're able to beat diseases such as polio, diphtheria, we're able to have control over tetanus, all kinds of problems that would have plagued mankind over the years. And vaccines and their development is a good thing for humans because it helps us to fight off infections and fight off otherwise lethal or debilitating types of illnesses. So it is a good thing for us to have developed vaccines to fight against the COVID-19. In COVID-19, there's a new technique that was used to develop vaccines. Instead of using the weakened or the dead germ or dead virus, we use particular protein sequences or the genetic material of the virus to then create the vaccine. When we use that genetic material, we then inject it into the muscle of the person on the shoulder, and the body recognizes that material, and it triggers the production of these things called spike proteins. Now, when the spike proteins are produced, then your body then does a second thing, which is to produce defense mechanisms against the spike protein. Why is the spike protein important? The spike protein is what the virus uses to enter into your cells. That spike, if you think about a Velcro, it's like a sticky part of the virus on the surface, and that attaches to the body's cells in the body. When it attaches, it then gets into the cells and causes the problems. So if you have defense mechanism against that sticky part that attaches to the cells, then you prevent it from attaching, prevent it from getting internalized into the cells and causing all kinds of problems. So that is the science behind a new technique. As a consequence of that, we are able to fast-track vaccine development. Vaccine development usually is a process that can take about 10 years. But in the COVID-19 pandemic, this new scientifically tested method is able to produce the COVID-19 mRNA type vaccine in a year or so. And that has moved from research in the laboratory to actually be able to use it on humans in a large scale. So there are three main ways to make vaccine antigens. These are proteins. One is to use the whole virus, and that produces a certain type of immune response in people. The other technique is to use a part of the virus, and then the newest technique, which I just spoke about, the mRNA technique, is actually to use the genetic coding for the virus. And now this is a highly complex process, and it would be beyond the scope of our discussion this afternoon. But just so you know that when this process happens, it is not a random or lucky type of approach. It has to go through a very strict process of scientific scrutiny, not just by one person or one group of persons. These things are examined by experts around the world before it is certified safe, firstly, for human consumption, and then once safety is ascertained, then we look towards success. There is no point in using something that is very successful but is not safe, or using something that is extremely safe but is not successful. So you have to find the right balance when introducing new technology for the fight against diseases. Again, the three types of coronavirus vaccines that are in development are: one, the protein-based one, which uses the virus itself. Then there is the viral vector. We use a normal cold virus, for example, which is injected and infected with the coronavirus, and that is then introduced to the patient. Or then the newest technique on the block is the mRNA type vaccines. And all of this basically centers around this spike protein that we talked about. Remember again, these spike proteins are like these sticky pieces of particles on the surface of the virus. And that stickiness allows it to attach to your body's cells, get into the cells, and then cause all kinds of damage. So if you can create a barrier or something that fights against that sticky protein, then you'll keep it from entering the cells. You'll keep it from actually getting in the cells and causing all kind of havoc. Because once it gets into the cell, then it reproduces itself. It creates more of itself. And so the less of those viral particles or viruses that enter the cells, the less chance they can replicate, the less chance they could cause damage to the human body. How does the mRNA vaccine work? To make it quite simple, we studied it in the lab first. Scientists then map out the genetic sequence of the virus itself, and they isolate something called a messenger RNA, which codes or is the code for the production of these spike proteins, and that is purified and injected into humans. Your body then produces these spike proteins, and it also then produces immune response or antibodies to fight against the spike proteins. So hopefully this would have shed some light, especially on the new mRNA vaccines that are available, and serve to at least reduce some of the fear and anxiety about the process involved in the development of these vaccines. Remember, if you have any questions or comments, feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Thank you once again for joining me, and do have a wonderful 2021.